Hey, I am a germ. You can call me bacteria. I am inside your patient's body. If you listen closely, you can hear the war that has already started. That is my other comrades causing an infection. We cause more than 750,000 cases of severe sepsis yearly. More than 30% will die. That is right. We kill over 200,000 of your patients a year. I like the very old, the very young, and those with weakened immune systems. Once we are in the body, we start out as a localized infection. For example, a wound infection or a UTI. Then, at his point, we are just a simple infection to you. Once we overwhelm a weakened patient's immune system and strike gold. Boom. The bloodstream. Once I am in the bloodstream, I become the medical nightmare. Sepsis. My army will overwhelm this patient's immune system. In a meager attempt to fight us off, the body's inflammatory process will damage itself, causing microclots. This will impair circulation and tissue perfusion. Your patient's organs will have no choice but to shut down and die. Unless you are smart enough to catch me before this happens. Ha! Remember these clinical signs of sepsis. If your patient presents with 2 or more of the following symptoms, this indicates that your patient has sepsis. Temperature greater than 100.4 degrees, or less than 96.8 degrees. Heart rate greater than 90 beats per minute. Respiratory rate greater than 24 breaths per minute, or CO2 less than 32 from NABG. White blood cell count greater than 12,000 or less than 4,000, or greater than 10% immature bands. Let me help you. You seem to be lost. Your patient meets the SIRS criteria. This is known as systemic inflammatory response syndrome. They may have additional signs and symptoms, besides 2 or more of the criteria for SIRS. Watch for the appearance of any 1 or more of the following: chills, hypotension, decreased skin perfusion, decreased urine output, significant edema, decreased capillary refill or mottling, hyperglycemia, plasma glucose greater than 120 in the absence of diabetes. You better get your nursing cap on. You are going to have to work now. You still have a chance to make a difference for your patient. If you are smart enough to know what you are looking for. If you do not know what you are looking for, or you act too slowly, you are going to lose this battle. If you are on the ball, go ahead, start an IV, draw a CBC, comprehensive metabolic panel, blood cultures ×2, draw lactic acid, start fluids, get some urine. Sucks to be your patient. Severe sepsis occurs when your patient meets the sepsis criteria showing 1 of the signs and symptoms of organ failure. Oops, you are in the woods. But all is not lost. Let me give you some clues to look for, because you obviously do not know. Remember the over 200,000 patients I have already killed. Yours could be next. This is a losing game for you. Get up out of your chair and get moving. Here is how to know if your patient is going into organ failure. Because I want to be fair to you, I will list them by body systems. Just to keep it simple. This part requires some assessment skills. Do you have any signs and symptoms of organ failure? Cardiovascular system failure. Systolic blood pressure, less than 90. Mean arterial pressure less than 65. Blood pressure drop from baseline pressure greater than 40. Tachycardia, arrhythmias, neurological system failure. Acutely altered from baseline mental state. Altered consciousness. Confusion, psychosis, a Glasgow Coma Scale score of less than 15. Pulmonary system failure. Respiratory rate greater than 24 breaths per minute. Oxygen saturation level less than 92% with patient on oxygen at 6 liters per minute using face mask. Gastrointestinal system failure. Absent bowel sounds. Renal system failure. Oliguria, anuria, despite volume resuscitation. Elevated creatinine. Hematologic system failure. Platelets less than 100,000. Acutely abnormal PT or PTT without anticoagulation therapy. INR greater than 1.5. PTT greater than 60 seconds. Hepatic system failure. Jaundice. Elevated liver enzymes. Decreased albumin. Decreased protein C levels. Increased D-dimer levels. Coagulopathy. Metabolic system failure. Serum lactate levels greater than 2. Okay, I see you are trying your best. Let me help you out. I will give you some treatment options step by step, because I can see you are lost. You probably do care about the care your patients is getting. Go figure. 1. Initiate resuscitation for sepsis-induced hypoperfusion. Transfusion of packed red blood cells. Administration of inotropic infusion, such as dobutamine. 2. Obtain appropriate diagnostics. Obtain at least 2 blood cultures. Obtain cultures of other sites, such as urine, wounds, and respiratory secretions before initiating antibiotic therapy. 3. Initiate antibiotic therapy. 4. Control the source of infection. Removal of potentially infected device, drainage of abscess, debridement of infected necrotic tissue. 5. Enhance perfusion. Fluid therapy, vasopressors, inotropic therapy. 6. Consider the use of steroids for patients with relative adrenal insufficiency. 7. Consider the use of drotarecogan alpha, recombinant human activated protein C, Xigris, for patients with sepsis-induced multiple organ failure with no absolute contraindication related to bleeding risk. 8. Administer blood products if hemoglobin is below 7. 9. Initiate mechanical ventilation if needed. 10. Provide sedation and analgesia. 11. Control the blood glucose level to maintain blood glucose less than 150. 12. Keep the kidneys functioning. Initiate renal replacement therapy in acute renal failure. 13. Initiate preventive measures. Use subcutaneously administered low molecular weight heparin or unfractionated heparin if appropriate, and mechanical compression devices to prevent deep vein thrombosis. Use histamine 2 receptor blockers to prevent stress peptic ulcers, should your efforts fail, because you dropped the ball or because I am just superior to you. I will cause multiple organ failure. Looks like you are about to have a bad day. 14. Looks like you and the team will be talking with the family about end-of-life care for your critically ill patients. I warned you, if you are caring for this patient in an emergency department, I hope your hospital has an ICU bed for this patient. If you are on a med-surg unit, get ready to transfer this patient to an ICU. Bone up on your SIRS criteria and knowledge of sepsis. I am coming for your patient. See you soon. Nursey.